Our next story is from the Netherlands, the story of a 28-year-old woman called Zoraya Ter Beek. She has chosen euthanasia, the act of dying with medical help. Of course, it's not new. So why is this case grabbing headlines? It's because Zoraya Ter Beek has decided to end her life due to crippling mental health problems. She suffers from depression, autism, and borderline personality disorder. She has sought help for it all her life, she says, but now she thinks there is nothing more that can be done. So she has chosen legal euthanasia. Her choice has sparked a lot of debate. Critics say it would encourage more people to kill themselves legally. I must warn you, this story could be triggering, so viewer discretion is advised.
Zoraya Ter Beek. She's 28. She's physically healthy. She lives in a Dutch village with her boyfriend and 2 cats. From a distance, her life sounds blissful, but it's far from that. Ter Beek has been dealing with mental health issues all her life. She grapples with crippling depression, autism, and borderline personality disorder. She has sought help for her problems. She has tried many treatments, but nothing has worked. So Ter Beek sees her mental illness as incurable, which is why she has now made a difficult choice. She has decided to be euthanized. Euthanasia is the practice of intentionally ending one's life. It is done by a doctor to limit a patient's suffering. Different countries have different euthanasia laws. In some countries like India, it's a crime, but in others, it's allowed. Currently, it's legal in around 10 nations. The Netherlands is one of them. In fact, it was the first country to legalize euthanasia in 2001, so patients can opt for it. The procedure will happen at her home. A doctor will first give her a sedative. Then she will be given a drug that will stop her heart. Her boyfriend will be by her side until the end. Following her death, Ter Beek will be cremated. She has even planned for her ashes to be scattered in a designated location in a forest. The move reflects a growing trend in the Netherlands. More and more people want to end their suffering from mental health issues. They don't want to endure it, so they are choosing euthanasia. Ter Beek's choice has sparked a lot of outrage. Some call it a worrying trend. They say euthanasia was long seen as the last resort, but increasingly it's becoming a viable option for patients. They are giving up more easily and opting for it. Not every country allows euthanasia for mental illnesses, but countries like the Netherlands and Belgium do. Many believe this encourages suicide. Others also blame healthcare professionals. They say with the option of euthanasia, they are giving up on critical patients more easily than before. Take the Netherlands, for example. In the last decade, the number of euthanasia deaths has steadily risen in the country. In 2022, it accounted for 5% of all deaths. So it's clearly no longer the last resort. While Ter Beek says that her life was never going to get any better, the fear is that it enables and encourages more people to kill themselves legally.